individuals stuck in active addiction are generally in deep emotional, sometimes physical pain, low on hope, and judging themselves without mercy. When I encounter them, I know they can find a way out, and I want to help them do that. And as I do, I need to be mindful that I don't get in their way as they find their way out. So I need to be careful not to judge, argue, lecture, give advice without permission. I need to be curious about them and interested in who they are as an individual, what their values are, what they think and feel about the situation they're in, and what ideas they have about getting out of it. Their ideas may be the same ones I might have. If they are the ones that put them into words, put those ideas into words, it's much more powerful than if I suggest what I think they ought to do. And my listening helps them find the power, the drive, the motivation, and the hope to make things better in their own lives.
When I got home from the hospital, the first call I got was from a program designed to help people like me, first-time offenders, substance abuse offenders. And I didn't get the call. It was a voicemail, and the voicemail said, "Mr. Martel, this is so-and-so from so-and-so. I'd like to talk to you about your recent DUI and whether you're ready to start making some big changes in your life." And I thought, yep, right on. That was definitely the call I was expecting. And then I thought about it for 30 seconds or so, and I was like, wait a minute. Like, in what universe is it okay to call someone you've never met and ask them if they're ready to change their life? You know, like, I'm a grown-ass man. You know, I've got a pile of college degrees, you know, like I've got letters after my name like everybody else. But I now have 3 new letters, and there are 3 letters you don't want. And the person who made that call saw those 3 letters and decided they could talk to me however the hell they wanted. Not as a professional, for sure, because that's not something a professional says. I was something lesser than. And that was the first call from people who were supposed to help me. Yeah, that was a glimpse into my new reality. And boy, did that suck.
When they treat you with this judgment and these assumptions, it's obvious. Now, I don't know if they think it's not, and they think, you know, that's normal behavior, but to the patient, it is obvious. And you can tell in the first 60 seconds if that provider thinks that about you or is approaching you with that assumption in mind. It's clear. It's clear. I noticed the same attitude with all of them. And I'm really not a person. They don't even make eye contact with you half of the time when they come in the room. And you're booked for a 15-minute appointment, and I've timed it before, and sometimes it's not even 5 minutes before they're in and out the door. And I'm just shaking my head like I didn't even get to say a fraction of what I wanted to tell them. So there's no way they could know me. And there's no way they could trust me if they don't even bother to have a conversation with me. They literally look at your history, see what meds you're on, what is it you want from me, see you later.
I had an experience years ago when I had the worst case of the flu I ever had, and I ended up having to go to the emergency room. And I always tell the doctors and dentists that I'm a person in recovery and that I want to be careful about medications. And so I did that. And then toward the end of the visit, the doctor was writing a prescription for cough medicine, and I asked what it was because I wanted to be careful. And I asked again, and the physician's assistant left the room to ask the doctor, and then came back in and said, it's okay, there's no alcohol in it. And to me, that wasn't the problem. It wasn't whether or not it had alcohol in it. It had to do with how that medication would interact with my own metabolism that might be risky for me as a person in recovery. So I think that there's a lot that we have to do as people in recovery to advocate for our needs and to help educate our partners.
So, and I think about listening and what I know about listening. When I was a young professional and I wanted to hurry up and help people and do something and solve this trouble, I was taught it's okay, you're already helping just by listening. And so that's a gift, right? To know that I don't really have to hurry up and fix this emergency in people's lives. And people are living with their trouble way before they came to talk to me. So I'm not going to be some kind of like miracle worker on the first day that they're telling me about what their trouble is. So just listening is helping. And that's an important message that helped me to be present with people. One of the other things I think a lot about what I've learned when I'm listening to people is that I arrive with all of my own narratives and my own stories. So when I'm hearing stuff, I'm hearing it through the lens of my experiences. And it's a little bit of work to let go of that and to stay curious and to stay present in with just what's happening to them. I'll often ask them, like, it sounds like this. Am I getting that right? Sometimes I'm not getting it right. And so checking in with that has been part of a tool that I use in the conversations that I have with people. And the questions that I ask are also part of the listening that I get to do, right? If I'm asking questions that are closed-ended, then I'm not going to get as much information to hear. I'm not going to hear as much information. And so questions that I ask often are, what's your mood, right? When we ask people, how are you? We get answers like fine or tired. How's your mood invites a different kind of an answer. Or how did that impact you? Instead of did it impact you? How did it impact you? Another question that I often ask when we're talking about trouble is that what were the messages that you grew up about this trouble? What were the messages you grew up about addiction? And what were the messages that or stories that you heard in your childhood about mental health care or going to therapy or recovery?
The recovery world has changed a lot in the last, certainly the last 10 or 15 years. And it used to be that people were very timid about revealing their recovery status because that is something that tended to be done in anonymous rooms where you spoke to other people who were just like you and you identified as an alcoholic or an addict. You used the language of those programs. And over the last 15 or 20 years maybe, people in recovery have found the value of saying, I'm a person in long-term recovery, and here's what that means for me. Because the more we do that, the more we convey hope to people.
That is, the terms that we would refer to people who have substance use disorder are all demeaning and negative, like calling them a drunk, calling them a junkie, calling them a dope fiend, calling them a crackhead. The list goes on and on. I can go on for half an hour. Now addressing them with substance use disorder, which is the change, right? Instead of calling them a junkie, calling them a person who has substance use disorder. Now, it no longer objectifies the person where they lose their humanity, and they can have a feeling of self-worth just by the way I'm addressing them, as opposed to feeling less than, and reinforcing that stigma of being a loser because they have this disease. That's not the case. And just a simple change of language expresses that.
One of our special programs is the emergency department coaching program. And that has just been marvelous because our coaches, who are people with lived experience, are working alongside nurses and doctors and counselors. And they're helping to create an awareness of what it means to be a person in recovery. And they're examples of how to support people who are struggling with substance use. And it's just been amazing to see because our medical partners tell us that it's very hard to avoid being burnout because you tend to see some of the same people over and over again, and you just don't understand why they won't simply do what you suggest. And it's simply not that easy.
And the research study is utilizing laboratory animals who develop dependence on opioids. And these laboratory animals that are now dependent on opioids, they have the freedom to self-administer, hit a lever and self-administer opioids. These laboratory animals are exposed to the opportunity to socialize with other laboratory animals. And that opportunity to socialize with other laboratory animals results in a diminishing of their self-administering drugs and a change in their behavior, a marked change in their behavior, this opportunity to socialize. When that opportunity to socialize is blended with a mild electric shock, a pain, a punishment, those laboratory animals will isolate, they will revert back to not socializing and revert back to self-administering drugs. It's my contention, and I think it will be a purpose of or a contention of the research study when it's completed, that mild electric shock is equal or tantamount to what we call stigma in our world. That a person reaching out for help, reaching out for connection, reaching out for acceptance, reaching out for support, reaching out for some pathway to health, when they are met with stigma, meaning like a judgmental, pejorative, punitive attitude, expression, tone, eye contact, when they're met with that, that is the equivalent of that mild electric shock. And people with addiction will isolate, resume languishing in the shadows. Their drug use will increase, and they may be lost forever.
And even people in active addiction who may or may not want help, you're still going to get further with them if you talk to them like a human being and not as if they're on trial and they have to prove to you, one way or the other. You can convince someone who may come in there not ready for help. They may leave there wanting to get help just based on how you talk to that person and how you have a conversation. That may be all it takes. Yeah.
The next call that I got was from the officer that arrested me, who I didn't remember because I was blacked out when I had my accident, and I needed to sign some paperwork for the citation. And when the officer got to my house, he came in, he shook my hand. He said, "Hey man, how you doing? You look good." And that was the second time he saved my life. The first time was when he sent me to the hospital after my accident. And I'll tell you, if you save somebody's life, it doesn't matter if it's an incidental part of your job. They'll love you for it forever. And yeah, he was just doing his job, but in so doing, he saved my life. And the second time, he just treated me like a person. He just said hello. How you doing?
So I think that there's a lot that we have to do as people in recovery to advocate for our needs and to help educate our partners. And so I've gotten to see that happen through the emergency department program, that there's more of a discussion now about what it means to help somebody be safe and to help people find and keep their wellness. You know, we have a lot of volunteers and guests who very often say that this feels like home to them. And that's the feeling that we wanted people to have, that it's a place to come for services, certainly, but it's more than anything, it's a place to come and know that you belong. And so we wanted it to be as inviting and comfortable as your own living room. We wanted people to come in and immediately see things, even subtle things that they didn't notice, that just made them feel that they were at home. They could smell that somebody's baking muffins in the kitchen. They can hear the click and the clack of the pool table, of a game of pool being played. And they hear somebody strumming on a guitar. The signs, the conversation, the laughter, all of it says, come in.